Hi, my name is Chloe and this is my oral administration video. I'm in course BSN 225 section 9. I'm in my uniform with my badge, and today we have our supplies for our patient. We have a clean pair of gloves, our medication cup, and then this medication cup for the capsules, and a clean gauze, our Tylenol, and a cup of water. Okay. So the first thing to do would be to go ahead and check the patient's order through the provider. We want to make sure that everything is lining up well, and this will start off with our 3 identifications of the medication so that it lowers the risk of error. And we would also start to go over the 6 rights of administration. Those 6 rights are correct patient, right dose, right route, right time, right drug, and right documentation. So once we go ahead and do that, we want to go ahead and look over at the MAR. Then we want to go ahead and go into the patient's room and introduce ourselves, okay? Hello, Miss Smith. My name is Chloe. I'm going to be your nurse today. Once we do that, we want to go ahead and check the room to see if there's any family members, visitors, anything that may violate HIPAA. We want to make sure that the patient is okay with them either staying or if they need to leave. Okay, so once we do that, we're going to go ahead and close the curtain for privacy. Miss Smith, can you please verify your full name and date of birth for me? Perfect. I'm also just going to check the wristband. Looks good. So today we're going to be going ahead and administering 5 oral medications per your doctor's order. Do you have any allergies that we should be aware of? No? Okay, great. So what we're going to do is we're going to go ahead and prep the medications. So I'm going to go ahead and put on my gloves after, well, first I'm going to wash my hands. Then I'm going to put on a pair of clean gloves. And Miss Smith, the medications that we're going to be administering today are Docusate sodium, warfarin, furosemide, potassium chloride, and acetaminophen. So first we're going to go ahead and confirm the medications at the bedside with the patient, with the order and the MAR, okay? We want to check our Tylenol, make sure that's correct. I do have the four medications in here, but prior I would prep them first. So we would, I didn't have the packaged ones from the school. I haven't received it yet. I got that package, but I don't have any of the medications. So we have the Docusate sodium, warfarin, potassium chloride, and then the furosemide. Sorry. And then we'll pour the Tylenol in a little bit. So once we do that, we want to go ahead and go over everything with the patient. And this is the time that we would also do the pre-administration, anything that needs to be done before giving the medications. So Ms. Smith, I'm just going to go over all the medications that we're going to be administering today. I'm going to go over what it is, the side effects, the adverse side effects, and if you have any questions, please feel free to ask me, okay? So we have Docusate sodium. We're going to be administering 100 milligrams. This medication is to treat or prevent occasional constipation. Side effects may include abdominal pain or cramping and nausea. Some adverse effects may be chest pain or a skin rash, okay? So before we administer it, we want to go ahead and check your temperature and to make sure all other vital signs are within normal range, okay? So next we have the warfarin. We're going to be administering 5 milligrams. Okay, maybe it was better if I just sit right here. Warfarin is used to treat or prevent blood clotting, also known as a blood thinner. What we want to do before administering is we want to go ahead and check the patient for any bleeding and check the CBC levels. Side effects may include for warfarin, side effects may include red or brown urine, black or bloody stool, and then adverse side effects could be severe bleeding or severe headaches. Okay, and we're going to be doing 5 milligrams of that today. Okay. Then the next medication we're going to be doing is the furosemide. That is going to be administered at 20 milligrams. This medication is to treat edema and swelling. What we want to do beforehand is we want to check your vital signs, specifically the blood pressure, for any hypertension. We want to also check your renal function and for hydration, okay? So side effects for this could be increased urine, increased thirst, dry mouth. Adverse side effects would be muscle cramping or dizziness, okay? And then next we have potassium chloride. Potassium chloride will be administered at 20 milliliters or MEQ. This medication is to treat low blood potassium, and this medication is beforehand we want to go ahead and check the blood pressure and for any orders of an EKG if needed per the doctor. Okay, so side effects for this could be stomach bloating, stomach pain, and then adverse side effects could be stomach bleeding and some chest pain or nausea. Okay. Lastly, we have acetaminophen. Acetaminophen is to treat, well, not treat, but to help with pain and fever. Some side effects of this could be stomach cramping or nausea, and adverse side effects could be loss of appetite, irregular heartbeat rhythms, and possibly some chest pain. So what we want to do before administering acetaminophen is we want to go ahead and check your temperature and find out where your pain is located at, okay? So those are the 5 medications that we're going to be going and administering today. Do you have any questions at the moment? No? Okay. So before administering, I want to go ahead and just confirm the medication again, make sure we have the right patient, just make sure everything is looking good. And Miss Smith, if you begin to feel any of those side effects or adverse side effects, please let us know as soon as possible or immediately as it's happening. We want to be able to help you, okay? Okay, so we have our oral medications here. And the patient is, okay, let's just do the oral first. So a patient is sitting up in a sitting position. And in this case, the patient is able to take all medications at once. There is no restrictions. So before we administer, we want to again confirm to see if they have any questions. And Miss Smith, would you like me to administer it, or do you want to do it? Okay. So I'm going to go ahead and administer the medication. There you go. And here is some water. So the 4 capsule medications have been administered. Miss Smith, if you start to feel any side effects, please let us know. You know, we want to prevent anything and help you the best that we can, okay? So just let me know if you start to feel anything. Next, we're going to go ahead and administer the Tylenol. The Tylenol is going to be 500 milligrams every 15 milliliters, okay? We want to make sure that I'm holding it to my palm. We want to make sure that this is on a flat surface so that we can make sure that we see the measurement, okay? Okay, I'm going to go ahead and administer. Okay, so we have 15 milliliters. And also, I wanted to mention, we also want to make sure that when we place this down, it is face up and not down. We don't want anything, you know, to spill anywhere, so we want to make sure that it's faced up, okay? Before putting it back on, we're just going to use this just to clean around, make sure nothing's there. Put this back on. Just again, clean up around the area, dispose of that. Okay, Miss Smith, are you ready to take the liquid administration now for the oral medication? Okay. Again, we want to confirm everything looks good. This is the right medication. Miss Smith is sitting up. Okay, Miss Smith, here you go. Okay. I'm also gonna see if she wants some water to help it go down. Miss Smith, would you like some water to help get it all down? Okay, here you go. Okay. Perfect. Now that we've administered the medications, we want to go ahead and get Miss Smith comfortable. Miss Smith, are you comfortable? Is there anything that I can get you? Okay, perfect. Again, Miss Smith, please let me know if you have any effects. Your call button is right here, and just let me know if you need anything, okay? So I would then remove my gloves. Perform hand hygiene and document my care. Thank you.